It starts with almost nothing. A scratch, a nip from a dog that seemed friendly enough. Maybe you don't even clean it properly. Maybe you laugh it off. Weeks go by. You forget it ever happened. And then one day, out of nowhere, you start to feel strange. A tingling at the old wound site, a headache that won't quit, a low fever. It feels like the flu. It feels like nothing at all, really. Except it isn't nothing. It's the beginning of one of the most lethal sequences the human body can experience. And by the time you notice it, the countdown may already be unstoppable. This is the story of rabies, a virus so old it likely terrorized our ancestors before recorded history, and so effective at killing that once symptoms begin, it kills essentially everyone it infects. Not most people, not the unlucky few, almost everyone, with extremely rare exceptions documented in modern medicine. To understand why one small bite can be a death sentence weeks after the fact, you have to understand exactly what this virus is doing inside you the entire time you feel fine. The rabies virus belongs to a family called lysoviruses, and it has one obsession: your nervous system. Unlike most viruses that spread rapidly through your bloodstream, rabies takes the slow road on purpose. After entering through a bite or scratch, the virus doesn't rush. It quietly replicates in the muscle tissue near the wound, almost hiding, evading your immune system's attention for days or even weeks. Then it finds what it's been looking for the entire time: a nerve ending.
Once rabies enters the nervous system, it does something most viruses can't do. It travels, not through your blood, but inside the nerves themselves, crawling along a structure called the axon, the long cable-like part of a nerve cell that normally carries electrical signals. Researchers studying viral neurotropism, the tendency of certain viruses to specifically target nerve tissue, have shown that rabies essentially hijacks the nerve's own internal transport system, the molecular machinery cells use to move materials along their length, and uses it as a highway directly toward the brain. This is why the location of the bite matters so much. A bite on the hand or foot, far from the brain and spinal cord, gives the virus a longer road to travel, sometimes allowing weeks or even months before symptoms appear. A bite on the face or neck, much closer to the central nervous system, can cut that incubation period down dramatically, sometimes to just days. The World Health Organization has noted that the incubation period for rabies typically ranges from 1 to 3 months, but documented cases have shown it stretching from under a week to over a year, depending on factors like the location and severity of the wound and the amount of virus introduced. For that entire stretch of time, you feel completely normal. This is what makes rabies so quietly terrifying. There's no symptoms screaming at you to act. The virus is moving in near silence, climbing nerve fiber by nerve fiber, getting closer to your brainstem and spinal cord, while you go about your normal life completely unaware anything is wrong.
This silent window is also the only window where rabies can still be stopped. Once the virus reaches the brain, there is currently no cure. But before symptoms start, a treatment called post-exposure prophylaxis, a series of rabies vaccine doses combined in some cases with rabies immunoglobulin, can prevent the virus from ever establishing itself, essentially training your immune system to destroy it before it completes its journey. The Centers for Disease Control and Prevention has stated that post-exposure prophylaxis is nearly 100% effective at preventing rabies when administered promptly after exposure and before symptoms begin. This is the reason doctors treat any animal bite, especially from dogs, bats, or wild mammals, as a potential emergency rather than a minor inconvenience. The asymptomatic phase isn't a sign that everything is fine. It's the only chance you get. But if that window closes, if the virus reaches the brain before treatment begins, everything changes, and it changes fast. Once rabies infects the brain, it triggers a condition called encephalitis, severe inflammation of brain tissue. This is when the symptoms most people associate with rabies finally appear, and they are unlike almost anything else in infectious disease. Confusion, agitation, hallucinations, and in many cases, an intense, painful spasm of the throat muscles whenever the person tries to drink water. A symptom so distinctive it gave rabies its historical nickname, hydrophobia, the fear of water.
The person isn't actually afraid of water in any psychological sense. Their throat and respiratory muscles go into involuntary, agonizing spasms at the mere sight, sound, or attempt to swallow liquid because the virus has hijacked the nerve pathways controlling those muscles. Researchers who have studied the neurological mechanisms behind this symptom describe it as one of the clearest signs of how completely the virus has taken over the brainstem's control of basic survival functions, the same brainstem responsible for breathing, swallowing, and heart rate regulation. From here, the progression is brutal and almost always identical. Once neurological symptoms begin, death typically follows within days, most often from respiratory failure or cardiac arrest as the virus disrupts the brainstem's control over the body's most basic life-sustaining functions. The World Health Organization estimates that rabies causes approximately 59,000 human deaths globally every year, with the overwhelming majority occurring in Asia and Africa, and the vast majority of those caused specifically by dog bites. Here's the part that makes rabies almost unique among deadly diseases. It is, in nearly every documented case, once symptoms appear, 100% fatal. Survival after the onset of symptoms has been recorded only a handful of times in medical history, and those rare survivors typically required extraordinary, experimental intensive care under very specific circumstances. For practical purposes, by the time the brain shows signs of infection, the outcome is already decided. And yet, despite all of this, rabies remains almost entirely preventable. The same virus that has a near-perfect kill rate once it reaches the brain has a near-perfect prevention rate if you act during that silent incubation window. Wash any bite or scratch immediately and thoroughly with soap and water. Seek medical attention as soon as possible, regardless of how minor the wound looks. Don't wait to see if symptoms appear, because by the time they do, the option to stop the virus may already be gone. This is the strange, almost paradoxical nature of rabies. It is one of the deadliest viruses known to science, and also one of the most preventable, separated by nothing more than how quickly you respond to a bite that in the moment might seem like nothing at all. The virus doesn't announce itself. It doesn't rush.
It simply waits, quietly traveling towards your brain along the very nerves that are supposed to protect you, counting on the fact that you'll forget the scratch ever happened before it's too late to matter.
Don't forget to like and subscribe